Let's take a look at Original Medicare. Original Medicare has two parts. Part A is hospital insurance. Part B is medical insurance. Medicare is provided by the federal government. Part A helps pay for hospital stays and inpatient care. Part B is medical insurance. Part A hospital insurance covers services provided during an inpatient hospital stay. Most covered services are listed here. This includes your room, your meals, and nursing and other services. One important thing you may notice missing from the list is doctor services. That's because doctor services are covered by Part B, even when you're in the hospital. Another thing to point out is that if you want a TV or phone in your room, you may have to pay for it. Part A doesn't cover these items. It also doesn't cover custodial care, which is care that helps with daily life activity like eating and bathing. Here are some additional important facts about Part A. Part A has a premium, but few people pay for it. Remember the FICA payroll tax? If you pay that for 10 years or more, you get Part A premium free. You can't be denied Part A coverage, regardless of your health or financial status, and you cover at any hospital in the country that accepts Medicare. Finally, you need to know a few terms to understand Part A benefits. Part A coverage and costs are based on a benefit period. A benefit period begins the day you are admitted to the hospital and ends after you've been out for 60 days in a row. Observation status is another important term. Part A covers hospital stays when you are admitted as an inpatient by doctor's orders, not if you're there for observation. If you stay overnight, Part B would pay some of these costs. Lifetime reserve days are extra covered hospital days you can draw on if you are in the hospital longer than 90 days. The maximum length of stay covered in a benefit period. You get 60 lifetime reserve days. Each can be used only once, but they can be applied to different benefit periods. We'll come back to these terms in a bit when we talk about costs. Now let's look at Part B, medical insurance. The main covered services are listed here, including doctor's visits, the tests or exams your doctor might order, and other outpatient services. Also, as we just discussed, Part B covers doctor services when you're in the hospital as well. There are a couple of things to point out here. First, the annual wellness visit is an opportunity to meet with your doctor to discuss your health status and goals. Things that a regular visit may not provide time for. It is covered 100% with no copay as long as it sticks to its purpose. If the discussion veers into current health problems like a cough, for example, or if you receive additional services that are not part of the visit, like lab tests, procedures, or certain other services, then there may be a cost. It is good to know this ahead of time to prevent any surprises. Here are a few other things that are covered by Medicare Part B. Clinical laboratory services like blood and urine tests, X-rays, MRIs, CAT scans, EKGs, and some other diagnostic tests. Some health programs like smoke cessation and obesity counseling, physical therapy, occupational therapy, and speech language pathology services, diabetes screening, education and certain supplies, mental health care, durable medical equipment for use at a home like wheelchairs and walkers, ambulatory surgery center services, ambulance and emergency room services. Here are some additional important facts about Part B. Part B has a monthly premium. If you're receiving Social Security or Railroad Retirement Board benefits, the amount will be deducted from your check each month. Again, we'll talk more about costs in just a minute. Just as Part A, you can't be denied Part B coverage, regardless of your health or financial status, and you may see any provider in the country that accepts Medicare. Finally, Part B charges a premium penalty for late enrollment, unless you qualify for a special enrollment period. We'll cover enrollment later in the presentation, but some people, including those who work past age 65, may delay Part B enrollment without a penalty. So we gone over what original Medicare Part A and Part B covers. Now let's look at what it doesn't cover. Many people are surprised to learn that they will have out-of-pocket costs, which could be significant depending on individual health care needs. Further, there is no out-of-pocket maximum, no financial protection with original Medicare. A serious illness or injury could create real financial stress. Another possible surprise is that original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision and hearing care, as well as any corrective treatments, long-term care such as in a nursing home, custodial care, which includes bathing, eating and dressing and may be called activities of daily living or ADL. Care received outside of the United States is not covered except in limited circumstances. The good news is that there are some options that may help you with these non-covered items, but first, let's take a look at all the items not covered. Eyeglasses, contacts, or hearing aids. It is important to note that although Medicare has a large network of doctors that accept Medicare assignment, some may not, and you may be responsible for these charges with original Medicare.